Hi guys, so in today's lecture we will discuss BLS, that is basic life support, particularly important in resuscitation of patients who collapse due to cardiac arrest. Everyone should know these basic steps of resuscitation, particularly CPR, so that one can save life whenever situation demands. Someone has rightly said, sole meaning of life is to serve humanity. You should carry mercy and kindness in your heart for all people. So let's discuss BLS, particularly in outside hospital scenarios, also known as out of hospital cardiac arrest. So let's discuss. Right, let's now discuss BLS, that is basic life support. This is a life saving skill which ideally each and everyone should know, not only healthcare or medical professionals. See, even a trained family member can provide quality CPR and save life. Even a lift operator can provide basic life support and save life. Even a bystander can provide BLS and save life whenever required. Okay, now let's discuss this BLS, that is basic life support, in detail. And now I will try to emphasize on the fact that core of this BLS training is providing high quality CPR, that is cardiopulmonary resuscitation. We will discuss this high quality CPR in detail in upcoming part of slides. As of now, just try to appreciate this fact that CPR is cardiopulmonary resuscitation. That is, you are going to support both cardiac system as well as respiratory system. In this particular diagram, you can appreciate chest compressions. These chest compressions will mechanically support your heart and they will help you maintain circulation of the victim. On the other hand, you can appreciate bag and mask ventilation over here. This is one of the methods to provide rescue breaths in case your patient has stopped breathing. Okay, this is how you provide rescue breaths. This is another method to provide rescue breaths, and this is mouth to mouth respiration or mouth to mouth breathing. Simultaneously, you have to also ensure the chest rise of patient to ensure adequate ventilation. Okay, we will discuss all these things in detail. Now try to understand one fact. What was the need of introducing this basic life support for layman people, for non-medical professionals? Try to understand this thing. See, in case of cardiac arrest, if you provide BLS, that is basic life support to patients, then chances of recovery and chances of survival increases. I am talking about cardiac arrest outside hospital, that is also known as out of hospital cardiac arrest. There might be no doctors around, therefore we are training general population to take care of people. I mean to provide initial resuscitation steps to those people who suffer cardiac arrest outside the hospital. Try to appreciate this particular thing, and how a layman person is going to decide whether a person is having cardiac arrest or not. See, a medical professional can decide whether a person is having ventricular tachycardia, ventricular fibrillation, asystole, pulseless electrical activity with help of ECG. But a layman person cannot understand what is the cause behind this cardiac arrest. But at least he can figure out whether a person is having cardiac arrest or not. Try to understand. He need to look for three things: whether a person is conscious or unconscious. How you are going to figure out whether a person is conscious or unconscious? You can tap on the shoulder of the patient and ask, what is your name? Are you okay or not? Something like that. If patient doesn't respond anything, try to assume that this patient is unconscious. Okay, now what are the other things? Try to also figure out whether this person is breathing or not, whether this person is breathing abnormally. Suppose this person is not breathing at all, or this person is having abnormal breathing in form of gasping type of respiration. And third thing, whether this person is having pulse or not. Just assume that your patient is pulseless. Now you have to assume this person is having cardiac arrest. You don't need to determine the reason for the cardiac arrest. Just you need to know what are you supposed to do in case you encounter such a person anywhere in your life, be it in cinema hall, be it at airport, be it in any school, something like that. If you encounter a person in this condition, assume this is cardiac arrest and immediately call for help and immediately start CPR, that is cardiopulmonary resuscitation. And if you can find automated external defibrillator, try to use it. Okay, it can be again very life saving. And in this particular thing, you have 5 components. You can remember all these things with help of Dr. Cab mnemonic. Initially, you have to assess the danger and you have to ensure scene safety. Suppose someone has collapsed in the middle of the road. You cannot provide CPR in the middle of the road. You can take this patient aside and you can make this person lie on his back and start providing CPR, and you can also call for help, and if someone brings the defibrillator you can also use it. Try to understand. First step is assessing the danger, ensuring the scene safety, whereas second thing is checking the response of the patient, whether patient is conscious, whether patient is breathing or not, whether patient is pulseless, and if patient is not breathing, pulseless, you can immediately call for help, because you might need more people to manage this patient, more people to provide high quality CPR, more people to call for emergency medical services, more people to bring the defibrillator in case it is available. And then you have to proceed in the direction of CAB, not ABC, that is airway breathing circulation. You have to provide cardiac support first, followed by airway management, and followed by breathing support. Okay, so this basic life support is for a victim who has suffered from cardiac arrest. This guy is not breathing properly and this guy is pulseless. Now you are supposed to provide chest compressions along with mouth to mouth breathing. In case you have bag and mask available, you can provide bag and mask ventilation. So basically you are going to provide what? Basic life support to patient having cardiac arrest. And main component of this BLS is providing quality CPR. That is, you are going to simultaneously support the cardiac system as well as the respiratory system, chest compressions as well as the rescue breath. Okay, now let's try to understand few things in detail. In case of basic life support, just knowing whether a person is in cardiac arrest is enough. Okay, no need to make differential diagnosis. So here you can make diagnosis of cardiac arrest if patient is pulseless, patient is not breathing, and patient is unconscious. Whereas in case of ACLS, that is advanced cardiac life support, in this case you make diagnosis of cardiac arrest and you also try to figure out the cause of this cardiac arrest. Take example of ventricular fibrillation. Take example of pulseless ventricular tachycardia. Take example of asystole in which you find straight line ECG. Take example of pulseless electrical activity, something like this. We will discuss ALS in subsequent lecture in detail. As of now, we are just focusing on BLS, in which it is more than enough if person identifies that someone is having cardiac arrest, and now patient can call for help, right? So that he can increase the manpower, and someone can also bring the defibrillator, someone can also call the personnel of emergency medical services so that this patient can be shifted to higher center for management. Now provide quality CPR. I'm again repeating this word, provide quality CPR. What is this quality CPR? We will discuss in detail. And later on, if automated external defibrillator is available, try to use this particular device. In this case, this device will identify whether it is a shockable rhythm or not. If it is a shockable rhythm, it will provide shock. And then you can continue with the CPR if it is needed. Whereas in case of ACLS, doctor decides whether to provide shock or not, whether to defibrillate this patient or not. Whereas in case of BLS, because it can be done by non-medical professionals as well, they cannot decide whether to shock this patient or not. Therefore, you have automated device which will figure out whether it is a shockable rhythm or not, and it will act accordingly. Okay. And in case of ACLS, doctor will decide whether it is ventricular fibrillation or pulseless ventricular tachycardia, whether to shock or not. In case of ACLS, though we will discuss, these are shockable rhythms, whereas asystole and pulseless electrical activity are non-shockable rhythms. Okay, and in this case patient will be managed with help of CPR and epinephrine. We will discuss. Now try to appreciate basic steps of this basic life support, that is BLS. Here you can appreciate that your patient is unresponsive with no breathing or abnormal breathing. Now urgently call for help. Okay, and then if you notice this patient is pulseless, it confirms your diagnosis of cardiac arrest. Now start CPR. In CPR, you have chest compressions as well as rescue breaths as well. So this is your quality CPR. In this quality CPR, you are supposed to provide chest compressions as well as rescue breaths. And the ratio of chest compressions versus rescue breaths is 30:2. This has to be noted. That is 30 chest compressions followed by 2 rescue breaths. which can be in form of mouth to mouth breathing, or it can be in form of bag and mask ventilations. Now, after every 5 cycles, you are supposed to reassess the patient. That will take approximately 2 minutes. But this reassessment should not be done for more than 10 seconds, okay? And then you have to continue the CPR again. Now, in case you have automated external defibrillator, you have to apply the pedals of the defibrillator over the chest of the patient. And in case the rhythm is shockable, this will do wonder. This will shock the patient. This will provide DC shock to the patient, and patient might improve as well. In case patient doesn't improve, you can carry on the CPR until medical helps arrive. Okay. Here in this particular diagram, this lady is trying to figure out whether this person is conscious or not, whether this person is breathing or not. For consciousness, this lady can tap at the shoulder of the patient and ask, what is your name? Whether are you okay? Are you not okay? Something like that. If patient doesn't respond, you can assume that this person is unconscious. But if patient doesn't respond, he might be in deep sleep as well. He might even hallucinate after taking some wonderful drug. Therefore, other parameters need to be looked for. For example, you need to look for breathing efforts, abnormal breathing or no breathing. You also need to assess the pulse of this patient, particularly central pulses, major pulses. So by tapping on the shoulder and asking whether you are okay or not, you can figure out whether a person is conscious or not. And you can also take your face close to the face of patient and assess whether this person is breathing or not. You can appreciate the breathing noise in case patient is breathing. You can also appreciate the chest rise. You can also feel the breath of patient if your face is close enough. Okay. Here we have a diagram how to palpate carotid pulse. So in this case, you have to look at the, or you have to feel at the major pulses, that is carotid or femoral. Peripheral pulses can anyway be absent if person has collapsed. So you have to assess the major pulses, and most important of them is your assessment of carotid pulse. This is how you assess the carotid pulse. In case even this pulse is absent, then your patient is pulseless. Now there is high probability that this person is having cardiac arrest. Immediately start high quality CPR. This is anatomical landmark representing position of this carotid artery. I hope you guys already know all these things. Now this picture denotes how to assess breathing of patient. This is very important. How to assess breathing of patient. And now you can appreciate, you can look, you can listen, and you can feel whether this person is breathing or not, whether the breathing is normal or abnormal. Try to appreciate. You can look for chest rise of patient. If there is significant chest rise, it means that your patient is breathing. You can also listen. You can also listen the breath sounds. For doing this, you can take your face closer to the face of patient, and you can also feel the breath of patient at your face if you are close enough. Okay, so you can feel the breath as well. So if none of them are present, you can assume that this patient is not breathing at all, and sometimes patient might have abnormal breathing in form of gasping. So this is danger sign. If patient is unresponsive, that is unconscious, if patient is not breathing, if patient is pulseless, assume that this guy is having cardiac arrest and immediately call for help and start giving quality CPR and defibrillate this patient with help of automated external defibrillator if available. Okay. Now, this is your automated external defibrillator. Nowadays, this particular device can be available at airports, shopping malls, schools, railway stations, because this is actually life-saving device. See, if this patient of cardiac arrest is suffering from pulseless ventricular tachycardia, though we are not supposed to make diagnosis in case of BLS, if this person is suffering from pulseless ventricular tachycardia or ventricular fibrillation, it is a shockable rhythm. Now, this is automated external defibrillator. This will detect the rhythm of patient, and in case it is shockable, it will provide shock. Patient might recover to some extent. Okay, we will discuss in detail. Here you can appreciate your defibrillator, that is automated external defibrillator with pedals, and these pedals are placed over the chest of patient, and these pedals will provide shock to the patients if patient is in a shockable rhythm, and this can be very beneficial. Okay. Now as we have earlier discussed that main core of this BLS is providing high quality CPR. Let's again return back to high quality CPR. As earlier mentioned, in case of CPR, you have to support cardiac system as well as respiratory system, and cardiac system can be supported with help of chest compressions, and respiratory system can be supported by bag and mask ventilation or mouth to mouth breathing, that is known as by providing rescue breaths. And what is the ratio of chest compression versus rescue breaths? It is 30 is to 2. Particularly we are talking about cardiopulmonary resuscitation of adults. Okay, this is very very important. Now let's discuss each and everything step by step. We are talking BLS, that is basic life support for patients who collapse and who have cardiac arrest in particular. See, here you can appreciate that patient has collapsed. This patient might be having cardiac arrest. Now, if this patient is pulseless, if this patient is not breathing, if this patient is unconscious, immediately call for help and start performing high quality CPR, chest compressions versus rescue breaths in the ratio 30 is to 2. And if there is automatic external defibrillator, try to use this device, and in case there is shockable rhythm, this will shock the patient and rhythm might be corrected. But you have to continue with the CPR until there is ROSC, that is return of spontaneous circulation, we will discuss. And later on this person can be shifted to hospital and advanced life support can be provided. Okay, let's again return back to our old mnemonic by the name of Dr. Cab. Here you can appreciate that it is CAB, that is circulation, airway and breathing, not ABC, that is airway, breathing and circulation. And first and foremost, you have to assess the danger. Therefore, you need to ensure scene safety first. Scene safety first. We have already discussed that if someone collapses in the middle of a traffic, then you need to take this patient to the side of the road and then you do the rest of formalities later. So ensure scene safety first and then assess responsiveness of patient. Check whether patient is unconscious, whether patient is pulseless, whether patient is breathing or not. Okay, suppose this is the case, then you immediately start high quality cardiopulmonary resuscitation followed by use of automated external defibrillator if available. So this CAB stands for chest compression, then you have airway, then you have breathing. Chest compression will mechanically support your heart, so it will result into pumping of blood and therefore brain circulation will be maintained. See, in case of cardiac arrest, patient might not be breathing. It is not because patient has some respiratory problem. It is because of decreased cerebral blood supply, resulting into lack of functioning of vital centers, which includes your cardiac center as well as your respiratory center. Therefore, by chest compressions, you are not only supporting your heart, you are supporting each and every organ. So this chest compression should come first. If you are providing proper chest compressions, blood supply will improve. Blood supply to brain will improve, resulting into regain of consciousness, resulting into spontaneous breathing. So this CAB should be followed. Okay, chest compressions followed by airway management in form of head tilt and chin lift, and breathing should be maintained with help of rescue breaths in form of mouth to mouth breathing or bag and mask ventilation. Okay, we have been talking about high quality CPR since the start of this lecture, and for high quality CPR you guys will need high quality of chest compressions as well. It is popularly said push hard and push fast. By saying push hard, I mean you have to push harder so that the chest compression is in the range of 5 to 6 centimeters. And by saying push fast, I mean chest compression should be in the range of 100 to 120 per minute. And you also give time for complete recoil of the chest to ensure diastolic filling of heart and minimize interruptions. By saying minimize interruptions, I mean to say that you have to provide at least 5 set of CPR lasting for 2 minutes, and then you are supposed to reassess this patient. You can look for the return of spontaneous breathing, return of spontaneous circulation or regain of consciousness of this patient. Okay, and this is your high quality CPR. Now let's take up a scenario. In this scenario, you can appreciate presence of unresponsive patient and this patient is not breathing normally or not breathing at all. Now your immediate work will be call for help. This help can bring automated external defibrillator over a period of time, which can be very very helpful, and simultaneously evaluate the pulse of this patient, particularly look for the pulsation in the carotid artery. If pulse is absent, then your immediate job will be to provide high quality CPR, and after giving 5 cycles of CPR, and that too for 2 minutes, you can re-evaluate the patient. If there is no return of spontaneous circulation, then again resume CPR until your automated external defibrillator arrives, or until the help arrives, which is supposed to take this person to higher center providing advanced life support at some hospital. Okay, now try to appreciate the components of high quality CPR. In case of high quality CPR, main thing is rate of CPR should be in the range of 100 to 120 per minute. Depth of the compression should be in the range of 5 to 6 centimeter. Plus there must be enough elastic recoil of the chest to ensure diastolic filling of the heart. Okay, and there must be minimum interruptions. There must be complete 5 cycles for 2 minutes, and then re-evaluation can be done. And in case this patient is not breathing, you have to provide rescue breaths as well in the ratio of 30:2. Okay. Let's also learn how to do chest compression in case of infants. In case of infants, you can apply two finger technique, or you can apply two thumb encircling technique. See, this is your two finger technique, and this is your thumb technique, that is encircling two thumb technique used for the chest compression of infants. Okay. Now, here you can appreciate chest compressions, and we have just discussed that for quality CPR you need quality chest compressions. So what is technique for this chest compression? First you have to interlock your fingers, and then you have to lock your elbows so that arm and forearm are aligned in a straight line, and rescuer's head and patient's chest should be opposite to each other, and this will result into effective depth of these compressions in the range of 5 to 6 centimeter. Now, having studied circulation, now let's also focus on airway and breathing. This circulation will be maintained by chest compression. And how to maintain this airway? This maintenance of airway will be by head tilt towards the back and chin lift. This will particularly align the trachea in a straight line, and then you have to ensure the breathing of this patient. This breathing of this patient, that is providing rescue breath, can be by mouth to mouth respiration, or can be by bag and mask ventilation if it is available. Try to appreciate this particular thing. This is your mouth to mouth respiration, whereas this is your bag and mask ventilation. And what is technique of this bag and mask ventilation? How you have to manage this mask while ventilating this patient? You have to make a sheet with help of your thumb and index finger, and you have to compress at this location so that your seal is tight and air is not able to escape. So you have to make particularly this C. This is your C, and then you have to make E, and this E will ensure the chin lift. So C will be related to compression so that air leaks will be lesser, whereas this E will be formed by these fingers, and this will ensure chin lift, something like this. So this is technique for bag and mask ventilation. How many rescue breaths? You are supposed to give 2 rescue breaths after 30 chest compressions. Okay. In case patient has pulse and you are supposed to provide only rescue breaths, then you are supposed to give one rescue breath every 6 seconds. Okay, let's try to understand this particular thing. You are supposed to give 30 chest compressions and 2 rescue breaths in case your patient is pulseless and your patient is not breathing. If your patient is not pulseless, if your patient is having pulse but your patient is not breathing, then you have to provide these rescue breaths every 6 seconds. Okay, now let's recap the steps of BLS. Suppose you encounter an unresponsive person not breathing at all, immediately call for help. This guy might bring automated external defibrillator for you. Simultaneously also check the pulse of patient, palpate the carotid pulse. In case this patient is also pulseless, now this is case of cardiac arrest, provide quality CPR to this patient, and the ratio of rescue breaths and ratio of chest compression should be in the range of 30:2. Now, in case automated external defibrillator arrives, you have to place the paddles over the chest of the patient, and in case the rhythm is shockable, this automated external defibrillator will check the rhythm and provide the shock, and then you need to continue the CPR until the help arrives. In case this patient is having pulse, now you don't need to provide the chest compression because heart is already beating. You just provide rescue breaths every 5 to 6 seconds, that is rescue breaths at the rate of 10 to 12 per minute. Okay, I think now this is very simple. Now let's discuss automated external defibrillator in detail. This is your AED and these are paddles of automated external defibrillator. Here you can appreciate the application of paddles of automated external defibrillator, and these paddles are arranged along the electrical axis of heart. One paddle is placed above the right nipple below the right clavicle and the other paddle is placed below the left nipple. This is electrical axis of heart. We have already discussed electrical axis of heart and lead to in our discussion on ECG. And now, in case there is any shockable rhythm, what are shockable rhythms? We will discuss all these things in case of advanced cardiac life support. Suppose there is shockable rhythm in form of ventricular fibrillation or pulseless ventricular tachycardia. This automated external defibrillator will provide shock to this patient. So this will provide defibrillation to the patient if it is shockable rhythm. Now you again need to continue with the CPR until the help arrives or until there is return of spontaneous circulation in the patient. Okay. Right, we have been studying about various steps of BLS. Now let's focus on particularly these three steps, that is circulation, followed by airway, followed by breathing. And by this chart you can appreciate that maintaining circulation is of utmost importance, and this will be maintained with help of quality CPR, particularly with help of chest compressions. These chest compressions will mechanically help your heart to push blood throughout the body, particularly maintaining the perfusion of brain. So brain perfusion is of utmost importance. When brain perfusion will be achieved, it will result into regain of consciousness. It will also result into regain of spontaneous breathing. It can also result into regain of spontaneous circulation. But sometimes even after your best efforts, you might not be able to save the brain of patient and later on the patient itself, so it can result into brain dead patient. Still in 40% of brain dead patients there can be return of spontaneous circulation, and when there is return of spontaneous circulation, now this patient will be eligible for organ donation. Though you failed to save the life or to save the brain of this patient, but you made this candidate eligible for organ donation, which will help out other patients related to liver and kidney diseases in particular. Okay, now let's recap. In case any patient collapses in front of you, you need to call for help, and if this collapse is due to cardiac arrest, you should immediately provide quality CPR, and if available you can use automated external defibrillator. Now you need emergency medical response. You need to shift this patient to higher center, particularly for advanced life support. Okay, now AHA has also added one more domain to this particular chain in form of recovery, and this recovery is related to neuroprognostication. We will discuss in our lecture on ACLS. Okay, now let's have final recap. If someone collapses in front of you, first thing is that to ensure scene safety, and later on you have to assess the breathing of this patient. In case your patient is not breathing at all, or if patient is having abnormal breathing in form of gasping, immediately call for help, and also look for the pulse, and carotid pulse has to be seen within the first 10 seconds itself. In case your patient is having pulselessness and your patient is not breathing, immediately assume that this patient is having cardiac arrest. Don't bother about the cause of the cardiac arrest. Immediately provide high quality CPR, and in case your automated external defibrillator is available, use it. In case the rhythm is shockable, this automated external defibrillator will provide shock to the patient, and this will help in improvement of the patient. But still, if there is no return of spontaneous circulation, you guys will need to continue the CPR until the help arrives. And now, if your patient is not pulseless, but patient is unconscious and patient is not breathing, then you don't have to provide the chest compressions. You have to only provide rescue breaths every 5 to 6 seconds, that is rescue breaths at the rate of 10 to 12 per minute. Right, this is all about BLS. In next lecture we will talk about ACLS, that is advanced cardiac life support. Bye bye.